Every minute counts when it comes to a stroke. But what happens when the signs go unrecognized? Today we're venturing into why strokes are often misdiagnosed, the signs you need to watch for, and, with a real-life example that we'll share later, how early action could save a life. If you find this information helpful, make sure to hit the like button and subscribe for more health insights like this one. Strokes are one of the leading causes of death and disability worldwide. But here's the problem. They are often missed or misdiagnosed, especially in younger people or those with less typical symptoms. Strokes can look different for everyone. Symptoms may be subtle, mistaken for migraines, inner ear issues, or even intoxication. We're going to look at why this happens and what you can do to make sure a stroke isn't overlooked. Let's get a quick understanding of what a stroke actually is. A stroke happens when blood flow to part of the brain is blocked, usually caused by a clot or a burst blood vessel. Without oxygen and nutrients, brain cells begin to die rapidly. That is why immediate treatment is critical. Brain cells die every second without proper blood flow. And the faster the stroke is treated, the better the chances for recovery. So why are strokes, as deadly and common as they are, often misdiagnosed? The reality is that stroke symptoms are incredibly varied. While some people experience sudden weakness or paralysis, others have dizziness, nausea, or slurred speech, symptoms that can mimic many other conditions. For instance, dizziness might be chalked up to an ear infection. Speech issues could be mistaken for anxiety or intoxication. Even serious weakness might be attributed to fatigue, especially in younger people who aren't seen as high risk for stroke. As an aside, in view of the serious nature of this topic, if you think this information is something that others need to know, please share this video with friends and family. You never know whose life it might help. Real stories highlight the danger of stroke misdiagnosis. Take Sarah, a 29-year-old who went to the ER with sudden dizziness and a severe headache. Doctors believed it was a migraine, but she was actually experiencing a stroke. Or Mark, a 50-year-old whose slurred speech was attributed to fatigue. Both of them went hours. When seconds count, they went hours without treatment. Time that can make all the difference in recovery. These scenarios are real and happen more often than we would like to think. Knowing the symptoms and speaking up could mean the difference between a full recovery and permanent damage. Let's get specific about the symptoms of a stroke. We often hear about the FAST method, which is very helpful. FAST stands for F, facial drooping. The A is arm weakness. S, speech difficulties. And T stands for time to call emergency services. FAST, very helpful. But strokes can have other symptoms too. Dizziness or vertigo, severe headaches, sudden confusion, blurred or double vision, trouble walking, and nausea or vomiting. If any of these symptoms come on suddenly, especially if they're intense, don't ignore them and don't hesitate to seek immediate help. Stroke does not discriminate, but it's often overlooked in certain groups. Women or younger people are at higher risk of being misdiagnosed, possibly because they don't fit the stereotypical stroke patient profile. For women, Symptoms can include fatigue, chest pain, or shortness of breath, which can be mistaken for anxiety or heart issues. Now, incidentally, regarding heart issues, you'll find our video in this series about heart attack misdiagnosis very informative as well. Young people, on the other hand, may be dismissed with a diagnosis of migraines or dehydration. Remember, if something feels off, trust your instincts. It's better to get checked out than to risk missing the window for effective treatment. So let's say you're with someone, or maybe it's you, who experiences these sudden symptoms. Here's what you need to do. Number 1, stay calm and don't waste time. Call emergency services immediately. Number 2, describe symptoms clearly to emergency responders. And here's a key tip. Mention that you suspect a stroke to prioritize testing and scans. Number 3, take note of the time the symptoms began. This is critical for doctors as certain treatments are only effective within a specific time frame. Once stroke symptoms start, brain cells begin to die at an alarming rate. Certain treatments, like clot-busting drugs, must be administered within a few hours of symptom onset. This is why it's critical to seek immediate medical attention at the first sign of a stroke. And while immediate treatment increases chances for recovery, waiting could mean permanent damage to brain function, affecting mobility, speech, and memory. To underscore that this message is not all gloom and doom, and to highlight the benefits of taking immediate action, we'd like to close with a wonderful, true story. A gentleman named Mark had a very heartwarming habit. Every day, before leaving early for work, he kissed his darling wife goodbye. Now, one morning, as he leaned in for his kiss, something wasn't right. Now, he wasn't exactly sure what it was, but he knew his wife well enough to know that something was off. Without hesitation, he called emergency medical, who were on the scene within minutes. His wife was having a stroke. Because little time was wasted, she is alive and well today, many years later. Now, Mark wouldn't call himself a hero, but what do you think? Please post a comment with your answer. We'd love to hear from you. So what's the lesson in this story for all of us? Well, think about that for a minute. What is the lesson for us? Well, if you said, kiss your loved ones every day, you're not only correct, but you deserve a kiss. The key lesson, though, on top of that is simple. Strokes can be unpredictable and life-altering, but being informed can make all the difference. Remember the key symptoms, especially the ones that don't seem like typical signs, and always trust your instincts. If you or someone you know experiences sudden changes in movement, speech, or sensation, don't wait. Seek help immediately, and again, mention the possibility of a stroke to emergency officials. So please, give this video a thumbs up, share it with those who you care about, and subscribe to our channel. And by all means, kiss the people that you love every single day. Who knows? That might just save their life. We are committed to bringing you common sense and life-saving information, and your support helps us to do just that.